Hey everyone, Dr. Joe here at House of Motion Chiropractic. Sitting next to me is Jill. Jill is a patient of mine who's been coming in for the last few weeks. Jill initially came in with some pretty severe neck pain, jaw pain, and multiple headaches a week that would totally derail her day if she had them. And that was going on for 6 years, right?
Yeah, long time.
She tried a few different things to see if she could figure out what the problem was, get some relief. Fortunately, nothing really worked for her, but luckily she was able to find chiropractic, got her into the clinic, and over the last few weeks, with some adjustments, at-home movement, we've been able to, almost virtually eliminate the headaches she's had in the weeks and really reduce the pain in the neck and in the jaw and allow things to kind of open up a little bit more so that she has more fluid movement without any of those pains. So what I want to do next is just kind of lead through an adjustment, what adjustment would typically look like, especially for somebody like Jill who is dealing with, those neck pains, jaw pains, upper back, and definitely the headaches. So Jill, we'll go ahead and we'll start face down. And so typically what I want to start with first is just kind of looking at the body to see, is there anywhere that I can see muscles being a little bit tight, breathing into the chest, is that normal, is both sides raising, lowering, checking foot length, things like that. So first thing that I do is I kind of come here into the thoracic region. So that's that area mid-back and up to the bottom of the neck where we have all that rib attachment. Typically we'll get a lot of tension into this area here, especially if we're working at a desk, looking at a computer for 8 hours a day, really pulls those shoulders forward. So always see some tightness here. So what I'm looking for, as I come through, I want to feel, is there any heat changes in the tissue itself? So that typically tells me there might be some inflammation there. Once I kind of find that, then I want to see, do we have the movement that we're feeling for? Do we have that motion in the joints? And typically if we find that area, we don't. So like right here, a little bit of restricted movement. I want to come in and just like that. Lots of movement, locked up there. Everything released beautifully. Come back through, kind of check, see if there's anywhere else in that mid-back area that we're having some of those issues with, the tightness, or right here, something a little specific. Gonna come in. So next I'm gonna come right here to a lot of problem areas for a lot of people, right at the base of the neck, going into that mid-back area. So definitely a lot of tension right here. And this becomes such a problem area for so many people because our head comes forward a lot of times when we're at that desk and we get just that tightness right there at that base of the neck. So we come in here and it already moved. That's how much she needed that movement. So there, that was the thoracic. We checked that out. Everything's moving better now. Come down here and we're gonna start here, down here at the ankles. Reason why I'm looking here is I want to see if there's any leg length discrepancy. So, a shorter leg versus a longer leg. When Jill came in with her initial exam, we found that typically her pelvis here is rocked back on the right side and rocked forward on that left side. You can see it actually causes one leg to be drawn up and one leg to be pushed down. So I look here, definitely have a leg where the right leg is a lot shorter than the left leg. Come up here just to make sure, feel, is that joint stuck in that direction? Yes, it is. Same thing on this side. All right, so Jill, go ahead and roll on your side facing over here. So we're looking kind of right in this area. That's where that hip tends to like to slide back and down, pulling that leg up. So that's where we want to get the motion back into play. So perfect. And to the other side. And then looking more at the sacrum here on this side. But same thing, we're just not getting the motion that we want. So we'll roll her towards me and perfect. Onto your back. Now here for Jill specifically is probably the most important area. Here in the neck is typically where we're gonna get all that tension that can lead to the pain in the neck, the headaches specifically, and can actually cause a lot of the jaw issues that we have. We have so many muscles that interact right here in this area that are connected to the spine, that the spine's typically the cause of why we have some of that jaw issues. So same thing, coming through here and just looking for where the movement isn't where we want it. So come in here, that left side here. Simple as that. and then checking back through, see if there's anywhere else. So just right here, top of the neck, right at the base of the skull, which is where a lot of the headaches are going to be coming from. A lot of tension right there. That again, that head forward position, you can see how much right there gets bundled up. All that tension pulls on the jaw, pulls on the spine, and causes pain, limited range of motion, and headaches. So allowing all that movement to kind of be restored back into the neck, allowing those muscles to relax, and then we eliminate those headaches, those painful movements, or even just sitting at the desk for long periods of time and having that constant ache. So this next adjustment is going to be basically a decompression of the spine. Really a lot of what we need is just a little bit of space in between each of the joints of the spine, and this is what typically helps the most. Beautiful. And then another big contributor to a lot of, especially lower back pain, is actually going to be the feet. Typically just from the shoes that we wear on a day-to-day basis. They're not always the best for our feet. They kind of close the toes in together, cause a little bit of pain issues into the toes, knees, and eventually up into the hips. So I always want to make sure that those joints are moving well. I'm just going to check everything one more time. All right, so we have a little bit more tightness right here at the bottom of the skull on the left side. So what I'm going to do is I'm going to do a different adjustment than we haven't done before. So let me help you up. And go ahead and turn. You'll face that way. Good. Let the head be heavy. Let that shoulder fall. Good. Nice, relax. Awesome. All right, so that is what a typical chiropractic session looks like here at House of Motion Chiropractic when we're dealing with things like intense neck pain, jaw pain, and headaches. If you are somebody that's suffering from something similar or other things like low back pain, sciatica, or lack of sleep, just know you don't have to suffer through that anymore. Here at House of Motion Chiropractic, we have come up with a formula that has helped hundreds of patients get back to doing what they love pain-free. That's through the chiropractic adjustment, postural analysis and correction, and functional movements to do at home to make sure that we're always making the progress that we need to. If you are ready to get to the root cause of the pain that you're experiencing and the limitations your body is experiencing, then go ahead and click below for the exam and consultation, a special that is over $100 off right now, and let's get you in here and get you feeling your best. So again, click that consultation link below, and I'll see you soon.